Hello, we are on. Welcome, everybody. Thanks for joining us. Welcome to this week's episode of Weekly Dose with Dr. Uday. I have a special guest today. Dr. Mukanga is going to be dishing on a lot of things. But what we're going to be specifically talking about is teeth whitening. So I think a lot of us are going to be tuning in. So we're going to be talking all about teeth whitening, what darkens or stains our teeth, and also tips from her on how to keep our teeth pearly white. Now, before we get into it, I'll start with introductions. For those that don't know me, my name is Dr. Uday. I am a board-certified family medicine physician. I am based in Martinsburg, West Virginia. I co-own a primary care practice, namely Apple Valley Family Medicine, and I also provide aesthetic services. With both modalities, my goal is to have my patients not only looking good, but feeling good as well. So Dr. Mukanga, I'm actually going to have you introduce yourself, and then we're going to get right into it.
Welcome. Hi. Thank you for having me, Dr. Uday. I'm Dr. Valerie Mukanga. I am a general dentist, and I'm the owner and CEO of Healing Wings Dental, which is a dental practice that is based in the Dallas area. And so what we do is we try to help people gain their wings in order by helping them maintain, and also regain like their oral health, proper oral health. So that's what we are about.
Well needed. So this topic, I think there's going to be a lot of interest in it because I get people all the time asking me how to whiten their teeth. Even me personally, I'm always looking for ways to keep my teeth white. So I will start with, what does the opposite? What stains the teeth and darkens our teeth from your perspective, Doc?
Yeah, so you have many things that can darken your teeth. Rather, you have things that people love to have every day, every morning, especially in America. Coffee. Some people can live without coffee, but coffee actually does stain teeth. Tea as well. You have things like red wine. It's all these things that people just love to wind down. But you have like food, like turmeric, things like that. Anything like that would actually cause your teeth to get stains. And also age also does cause people to have darker teeth over time. But yeah, those are pretty much like some things that can cause your teeth to get stained. The last thing I was going to talk about is medication. Some type of antibiotics would cause, like doxycycline. People used to use that way back in the days, and it really, really would stain teeth. And that's very hard to whiten with just regular, products. So with those, you have to actually make things like veneers or, things like that to actually cover the teeth. So yeah, there are many things that can stain your teeth.
Gotcha. For me, out of curiosity, does curry do that?
What happened? Curry. Oh yeah. Curry, turmeric, about the same.
I do a lot of curry. Okay. All right. So now another curiosity for me. So for people that do the wine and do coffee and stuff like that, if they use a straw, does that help?
Straw does help because it helps in that you're not going to have that you're not going to have the fluid directly on your teeth, so it does help. Yes, it does.
Gotcha. I gotcha. So I just want to get my personal questions out the way. Okay, so as you can tell, right? So okay, so from your perspective, what would you suggest? What tips would you suggest for people to help prevent stains? And then how do you help your patients that come to you asking about whitening? How do you help them?
Oh, absolutely. So there are many ways of whitening teeth, ways that go from home care and also office care. So I'm going to start by first, and even nutrition. So I want to start with nutrition. You want to drink a lot of water. So yes, you love to drink tea, you love to drink your coffee, your red wine. Just make sure that you drink water afterwards because it washes out the fluid and it helps reduce, the staining. So that's water. You also want to eat a lot of product like like that are very fibrous, like carrots or celery, things like that, because it's going to increase the production of saliva, and that's going to wash out also the stain of your teeth. So so that's kind of like nutrition wise, what I can talk about. But now, as far as home care, you have many different things going from toothpaste whitening. That's easy. What it does is it's going to remove, the debris from your teeth. But beside whitening, you want to also think about just regular oral care, because after eating or drinking, if you brush your teeth, you floss your teeth, that's also going to reduce, the effect that those kind of food would have on your teeth. So you have that. You also have some home some over-the-counter things that you can use. There are some whitening, like I said, whitening toothpaste first of all, and then you have whitening strips, right? Whitening strips, those would help. You also have some whitening gel with like LED light. Those also help, and all of those you can find over the counter, even in your regular grocery stores or in the pharmacy. So those are some of the things that you can use. Of course, you want to use it with caution, but those are things that you can use. They also sell whitening pens that you can use, and that would also help. So those are some of the things that you can do at home. But besides that, coming to an office, a dental practice, you can see your dentist, and they will be able to also help you whitening your teeth by two different ways mostly. They can construct or fabricate a whitening tray for you, and they will send you home with some gel that you would put in the tray, and you can either sleep with them and remove them and kind of rinse your mouth in the morning. Or if your teeth are more sensitive, you can use it for a few minutes. I would say like 30 minutes or so. And even with the tray, sometimes, like when I would use it, when I used to use them, I was not able to use them every day because my more like on the sensitive side. So you can kind of like skip a day, and that would also lead you to the result that you want. Now, the last thing that we do in office is do the whitening with LED light. And so that you will see the result faster. So by the time you get out of the chair, you can see a greater result, because the other ones, it's kind of like an accumulative effect that would cause you to see the change. But yeah, so we can do it in office. And the advantage of having that done in office is that we know exactly where we place the material. And so, because there are some things that some side effects, of whitening, which I'm sure you would ask me about. So, yes, in the office, we're able to control better the outcome and reduce also some of the defects or damages that can occur from whitening.
So for me, the one I remember is sensitivity. Is there anything that can be done with the sensitivity when you professionally try to get it done? Because I remember doing something like that, and I remember the sensitivity that did not feel good at all.
Yeah, so there are some people, say for example, you were to have the whitening done on the chair at the doctor. It can be either reducing sensitivity can also happen when you break up the steps, because sometimes you need 2 steps in order to whiten it. If you do it the same day, you will have increased sensitivity. But another thing that you can do also is like use fluoride rinses. Those help. And also we use some aloe vera gel that also help kind of like decrease the sensitivity, especially in the gum. Yes.
And you were kind of alluding to side effects. So do you want to talk a little bit about the side effects?
Yeah, some of the side effect would be like if you do it too often, or if you don't follow, first of all, if you don't follow instructions. If it tells you to just put a little and you're like, no, I want to see it freeze up faster, and you just blab the product on there, yes, that would cause you issues. So you want to follow directions, first of all. And then another thing is like do it in moderation, because even though whitening is not like final, it's not something that you do once and then that's it, you set for life. You have to kind of revisit, re-whiten every so often. So doing it too much can cause you problems. It can cause decalcification of your enamel, more sensitivity. It can also cause, even if it's just too much, it can actually cause problems or at your pulp or the nerve. It can kind of like numb your nerve if you do it too much. So those are kind of like some of the side effects, yeah. And obviously, like if you don't know what you're doing, that's a big problem. Yeah.
Gotcha. This is all really, really great information. So I'm going to flip to the other and just ask you a few questions. I always ask all the doctors that come on, why they do what they do. So I'm going to ask you the same question. Why do you do what you do, Doc?
Yeah, so the reason why I do what I do, which I love doing, being a dentist, is that I really grew up in a family where a lot of people had dental problems, including myself. So when I was younger, I lost one of my teeth, a front tooth. And so it's dentistry that helped me, regain my smile back. So yeah, so that really is one of the reasons. But another reason is also that later on in life, when I was in college, I lost my uncle, my mother's brother, and he had an infection. And so because of cavities, and so that ended up causing him a stroke, which is something that you don't always hear, but it does happen. It's very rare, but it can happen. And so because of lack of proper oral care.
Thank you.
And so for lack of proper oral care, you can actually end up having issues such as, strokes or heart attacks, things that you can't even fathom. But yeah, those are some of the reasons that caused me to want to become a dentist and make a difference in people's
Those are
lives.
really important reasons that you have there. So, and this is definitely a well-needed field for sure. So we really appreciate what you do. Now, the other thing I always ask, and I know you've been here before, but I did ask, is if you could speak to your 20-year-old self, all the life and experiences that you've had, what would you say?
I would say don't hesitate on doing what you want to do. So when I went to college, after finishing college, university, my bachelor degree, I said, I need to take a break. And so I thought I was going to take 1 year break. It went all the way to just almost about 10 years. And so please don't do that. Just if you have a dream, go for it. Because when you're done, you have all your time to rest anyway. So I would have told my younger self, just keep going. Just keep going.
I love it. Oh, thank you so much, Dr. Mukanga. So if people are looking to schedule with you, look you up, how can they find you?
They can find us at Healing Wings Dental, which is in Arlington, Texas, located at 4101 West Green Oaks Boulevard, suite number 317. They can also call us 972-213-0202, or they can schedule an appointment on our website, which is healingwingsdental.com. But they can also find us on our social media by just typing Healing Wings Dental on YouTube or on Facebook, on Instagram, and also on LinkedIn.
Yay, this was so good. So guys, check her out. She is amazing. And on the flip side, if you're looking for a quality family medicine physician, Apple Valley, we love taking care of our patients and we're accepting new patients. So you can look us up online at www.applevalleyfamilymed.com, or you can call us at 304-350-1087. You guys have an amazing week. Thanks, Dr. Mukanga.
Thank you so much for having me. Bye.
Bye.